Obstructive sleep apnea is where a patient has difficulty in breathing during sleep. As a matter of fact, the terminology is now changing so that we talk about sleep disordered breathing, because there is a whole spectrum of problems of breathing during sleep. There are some which are mild, some are just moderate, and some are severe. Obstructive sleep apnea is when it's almost the severe type, because then the person who is having sleep disordered breathing may at times stop to breathe during sleep because there is a blockage in the passage of breathing. Yes, obstructive sleep apnea or sleep disordered breathing is common. It gets more prevalent with age. It is commoner in adult males more than adult females. You will find that in ages after about 50 years, maybe about 30 to 40% of males will have sleep disordered breathing. And like I said, all grades of sleep disordered breathing, from the mild to the obstructive sleep apnea. It is during sleep that our body rejuvenates itself and our body relaxes so that we prepare ourselves for the following day. So when your sleep is disrupted, it means there are various functions of your body that are disrupted. First is that if you don't have enough sleep, then you will be drowsy the following day. So one of the major impacts of sleep disordered breathing is a general sleepiness during the day, what we call somnolence. People who have especially severe sleep disordered breathing tend to fall asleep at inappropriate times during the day. Whatever they are doing, they could be driving, they could be sitting, they could be in conversation. And if you are falling asleep, then for example, people who drive, you can have very serious accidents. As a matter of fact, it's known that with regard to long distance drivers, one of the commonest causes of accidents in them is because of inappropriate or inadequate sleep, which may be as a consequence of sleep disordered breathing. The other impact is the fact that if you've not slept, you tend to be high strung during the day. You tend to be very temperamental, and many people are not relaxed, so they are at an edge most of the time. The other thing is it dulls your intellectual output, so a lot of people find that they are not able to solve problems easily if they don't sleep well, and this has been shown. Even their responses to simple tasks, their motor skills are slowed down, so that their reaction time is much lower. Then you find that simple problems, simple issues that you would be able to articulate become difficult problems, that sometimes you have interrupted thought processes so that you are not able to solve problems. The other thing is that there are also certain changes in functions of the body, control of blood pressure, heart rate. Patients that don't sleep well because of sleep disordered breathing are more likely to get hypertension. And if they have high blood pressure, it's more likely to be out of control. So that the drug that normally would control the blood pressure, you find they are not controlling it. Then it has also been found that poor sleep promotes irregularity of the heartbeat. So they are more likely to get heart attacks from irregular heartbeat. And the chemical process of breakdown of food substances in the body is affected, such that people with sleep disordered breathing have a higher risk of developing diabetes. And if they are diabetic, the diabetic control is worse than in people who have a good sleep. Sleep apnea or disordered sleep breathing is confirmed, one, through history, because there is the fact that people who, like the symptoms I've already described, that loud snoring at night, turning in bed, waking up multiple times from sleep, that is a history. Then there is the examination to find out whether there are areas of obstruction. In addition, there are certain investigations that can be done. One is there are certain imaging investigation, that is MRI, CT scans, to determine areas of obstruction. Then there are studies, sleep studies, where you can, there is some equipment that you wear at night which monitors your sleep. It monitors the effort you are making to breathe. It records your snoring levels. It records your oxygen levels during sleep, so that when we look at the pattern, of your sleep, we are able to determine whether this is a sleep disordered breathing and what is the severity. Because we can work out, for example, how many times during the night did you wake up because you are not getting enough oxygen. And this will be used as an index to indicate the severity of your disease. Finally, we do what we call drug-induced sleep endoscopy. That is where we put you to sleep, and we can, within about 20 minutes or so, we examine the pathways that air passes through to determine which are the areas that block. For example, some people block in the nose, some people block behind the nose, some people block behind the tongue, where the tongue falls back during sleep. Some people will block below the tongue before the air goes into the windpipe. The other way of finding out about, making a diagnosis is where you get admitted into a sleep lab. The sleep lab is made so that you are monitored both in terms of being connected to a special gadget that will record your oxygen levels, but also there are cameras that record the way you sleep, because again the way you sleep may be determined whether it makes your problem of sleep disordered breathing worse. For example, there are people, if your tongue falls back and you're sleeping on your back, it will become worse. So the camera in a sleep lab, the connections to a machine that monitors your body functions during the night, the totality of all this is used to make a diagnosis of sleep disordered breathing. Now, there are three main treatment options. One is the lifestyle, changes in lifestyle. A good number of people who have sleep disordered breathing have a high BMI. As BMI is really your weight divided by your height. And if you have excess weight, you're more likely to develop sleep disordered breathing. So if your BMI is higher than normal, then the first thing you want to do is bring down that BMI. That will include diet and exercise. So that is your lifestyle. The second treatment, depending on what is found during the drug-induced sleep endoscopy, may be surgery. That there are certain areas that may be amenable to surgery to open up your airway so that there is no obstruction during sleep. There are various surgeries that can be done. Some are done in the nose, some are done in the mouth, some are done in the throat. Now, all these are different surgeries. Sometimes the surgeries may even be involve moving your jaw forward, the lower jaw, to try and move the tongue forward. There are other treatments coming into the market. There is now a very promising treatment which will involve stimulation of your tongue during sleep. When your oxygen level goes down, a message is sent to the muscles of the tongue which move the tongue forward, which means that if the tongue was falling back and it is moved forward, it opens up. The third modality of treatment is the use of a special equipment called CPAP. CPAP stands for continuous positive airway pressure. And the CPAP machine you wear at night. And what this machine does is it increases the pressure of the air getting into your nose. And once you increase the pressure of the air getting into your nose, the pressure keeps your airway open. So you have to use the CPAP machine every night. Now, a lot of people find, of course, that because you are wearing something is a little bit uncomfortable and the compliance rate may not be as high as one would want. But there are people who find that every day they use the CPAP, the following day they are much better. So they will always use it because it gives them like a new lease of life. Yeah.